Namaste and welcome to another session of Living Ayurveda. Today we'll be discussing about Marma Therapy or Marma Chikitsa. Before we begin, I'd like to share a story from the Chandogya Upanishad. The five senses once had a debate on who was most superior. So to settle their issue, they went to Prajapati, their father, and he said that one by one you should leave the body and then see the side effects or the aftermath of the absence of each sense to decide who is most important. So the first one to leave was speech, and after it returned a year later, it asked the others, "How have you been in my absence?" So they replied, "Well, we were speechless, but we could hear, we could see, we could breathe, and we could think because of the presence of the eyes, ears, mind, and prana." So the next to leave was the sense of vision or eyes. And when that returned after a year, it asked, "How have you been in my absence?" The other senses replied, "Well, we were blind, but we could hear, we could breathe because there was prana, we could think because the mind was there, and we could speak." The next to leave was the sense of hearing, the ears, and it returned and again asked the same question. "So how were you in my absence?" They replied, "Well, we could breathe because we had prana, we could think because the mind was there, we could see because the eyes were there, and we could speak." And so on. And then when it returned, they said, "Well, we were mindless, so we could not think. We were like a small baby, but we were breathing because there was prana, we could speak, we could see and hear." And finally, the fifth sense, prana, was about to leave. And as it made the effort to leave, all the other senses held on to it and said, No, please don't leave, because we can't survive without you. So the power of speech, the power of sight, hearing, and thinking are all dependent on the presence of prana. So prana is essential for existence, for survival. So what is prana? Prana is often translated as breath, but this is not an accurate translation, because breath is actually the physical breath. It is shwas. So shwas is the physical breath, but prana is the subtle energy or the subtle life force which is present. And so both are related to each other, but they are different. Because breath or shwas is something that can be easily accessed, there is pranayama, which is regulation of the breath, which leads to a change in the pattern of the prana, which is the subtle force. So you can access the prana through the breath. The prana travels throughout the body in subtle channels, which are called the nadis. And yoga describes 72,000 nadis. These are present throughout the body, and there are 6 chakras, which are actually the points where these nadis meet. So the 6 chakras, beginning from the Mooladhara at the base of the spine, the Swadhisthana, the Manipur in the umbilical region, Anahat in the region of the heart, Vishuddhi in the throat, and finally Agya Chakra in the region where the 2 eyebrows meet. And then we have the Sahasrara, which is the crown. So these channels meet at these points. So we can understand it like this. If there is electricity, it moves in the electrical wires. So the energy is electricity and it moves in the wires. And then we have the transformers, which are the junction points of the various wires. In the same way, these chakras can be described as the junction of the nadis. So they are powerful centers which regulate the energy. So it could be down-regulated or it could be exaggerated. So these points, they serve as important centers to regulate this energy. Marma points are also similar points they function like mini chakras, or they are like small transformers which can help regulate this energy. So these Marma points can be used to benefit health. So let us see how that happens. Marma, the word in Sanskrit, means hidden or secret. So it originates from the word mri, that is a root, which means death. So mriyate anena iti marma, that is, that which is inflicted, if inflicted by injury, that which can cause death is a marma. So these marma points are sensitive points, which an injury on these points can be lethal. So marma points are specific areas of the body which have relation through pranic channels to various internal organs, doshas and channels. So the doshas, as we know, are Vata, Pitta and Kapha, and the various channels in the body, which include the channels for food, the digestive tract, include the channels for respiration, breathing, and the channels for transport of water, and so on. So a marma point is the junction between physiology and consciousness. So it's where both energy and matter meet. Because of the relationship to prana, it is the junction between matter and energy. So marma therapy is the art of stimulating the right place of the marma for the purpose of healing. So what are the benefits of marma therapy? It's an important tool for disease prevention and treatment. So one could practice self-marma massage or marma stimulation to prevent disease, and also it can be used to treat any imbalance or disease because it balances the doshas. So stimulating the marmas will lead to a balance of the doshas, Vata, Pitta and Kapha, improve Agni, thereby improving digestion and elimination, enhances immunity, and clears emotional blockages, facilitating the experience of deep peace. As we said, the marmas are related to particular areas of the body. So if we stimulate a marma that is related or connected to the liver and spleen, it will correct imbalances in the liver and spleen. And if there is a problem in the liver, that marma which is connected to the liver will be tender or painful to touch. So these marmas are also diagnostic. So if there is pain or tenderness in that marma, we can understand or we can infer that there is a problem in the organ or system connected to that marma. So they are both diagnostic as well as therapeutic. And interestingly, we see that when we stimulate a certain marma and there is pain or tenderness, it means it reflects a pathology in the organ connected to it. But if we see that most of the marmas in the body are tender, even though the pathology is present only in one particular organ, but still all the other marma points are also tender, that usually reflects a lot of emotional blockage. And usually patients with chronic fatigue syndrome, which actually represent depression, come with that kind of presentation. So by stimulating these marma points, we are releasing that emotional blockage, and therefore it facilitates the experience of deep peace. Stimulation of these points increases energy level, provides pain relief, and this is an important benefit of marma therapy. Often there are patients with spinal conditions who are advised surgery, and spinal surgery can be very serious and can have complications, but many such patients experience a lot of relief by just stimulation of these marma points. So marma therapy is free of cost. Once we learn the right technique of stimulation, this is a therapy which can be used anywhere. You don't need any equipment, you don't need any drugs, and you don't incur any cost. and you can avoid a lot of pain medication and unnecessary surgery. Stimulation of these Marma points strengthens internal organs, and thereby it slows the aging process. So Marma points are basically anatomical sites where muscles, tendons, ligaments, and blood vessels meet, and pran, or vital energy of the body, resides. Different marmas are located in different parts of the body, and they're made up of different elements. So some are muscular marmas, some have more blood vessels, whereas others are present at the junction of bones, that is, in the joints. So there are a total of 107 marmas that have been described. 22 are present on the lower extremities, 11 on each side, left and right. 22 on the upper extremities, so 11 in each arm. 12 on the front of the trunk, 14 on the back, and 37 on the head and neck. So there is a concentration of marmas on the head and neck area. Marma points are traditionally located and measured by finger width, which is called anguli. So a marma could be half an anguli, that is half a finger width wide, or it could be 1 anguli or 2 angulis, and so on. So let's begin with the first marma, which is the Sthapni Marma on the forehead, which is in the region of the Agya Chakra, the third eye, where the two eyebrows meet in the middle of the forehead. And this is used to build concentration and memory. And stimulation of this marma relieves insomnia or a lack of sleep. It can also be used to relieve a headache. And because it is in the region that corresponds to the pituitary gland, it creates a hormonal balance and can also relieve eye strain and sinus conditions, especially of the frontal sinus here in the forehead. So you would have often experienced that when you're thinking, you tend to tap your forehead like this. So this is, you're stimulating the Sthapni Marma. Also when Shirodhara is done, that's a continuous stream or of oil which is poured on the forehead. It is usually poured at this point. So it stimulates this point and gives all these benefits. When one does the Balasana or the child pose and you bend forward, so the point that touches the ground is the Sthapni Marma. So we see that many yoga asanas or postures actually lead to stimulation of these Marma points. Then we have the Seemant Marma, which is actually here in the midline. So it is right here in the midline. It joins the bones of the left side and the right side. And this is used in developmental disorders in children. So stimulation of this marma will help to develop the brain and also can be used to relieve a headache. And in fact, for any mental disorders and psychiatric conditions, it is good to stimulate this marma. So as you see here, the marma is being pressed. If you press with this technique, we are also pressing the other marmas which are present here in the outer region of the eye, the Apanga Marma, which we'll see just in a minute. So this way we can stimulate this marma and derive all these benefits. The next is the Avarta Marma, which is situated above the eyebrows, somewhere here, which is just a little outside the midpoint of the eyebrows. There is a depression here in the orbital fossa. So if you move your fingers along the eyebrow, you will feel that there is a depression just outside or lateral to the midpoint of the eyebrows. So the pressure is applied with the fingers. The eye should be kept closed, and the pressure is applied backwards and upwards and not downwards to prevent any damage to the eyeball. This is usually tender. It's a very sensitive marma. It helps to relieve eye strain. It improves vision, strengthens the eye muscles, so can be used for visual defects, For squints, it helps relieve headaches and soothes dry eye, which is a condition which is very commonly seen these days. Also helps with frontal sinusitis and mitigates facial paralysis. So the Avarta Marma can be stimulated like this. The next Marma near the eye is the Apang Marma, which is actually situated in the outer region of the eyebrow. So if you run your fingers down the eyebrows to the outer edge, you find a small pit there. And this Marma is situated in the pit on the outer edge of the eyebrow. And stimulation of this Marma also relieves eye strain, especially for those of us who have to work on the computer for long hours. It's good to stimulate this Marma. It improves vision, strengthens the eye muscles, and very good to relieve headache. The next Marma on the face, which is important, is the Phana Marma. And this benefits the sense of smell, good for sinusitis, and to help cure nasal allergies. So the hand can be placed like this in an open lotus posture, and the little finger is placed here. There's a depression right below the nose. And by placing the hand like this, we are actually preventing too much pressure. And so we use the little finger to stimulate this. And this has very good results with people with nasal allergies and when there is a reduction in the sense of smell. The Vidura Marma, which is present behind the ear. So if you see just behind the ear, there's a depression in the lower part, and which is in front of the mastoid process. So here we have the mastoid bone, and just anterior to that mastoid process behind the pinna or the ear is the Vidura Marma. So stimulating this Marma helps to benefit hearing loss, tinnitus, which is a condition where there is constant humming sound in the ear, also helps patients with recurrent ear infections, and insomnia, that is lack of sleep. These are the marmas in the extremities. So the Ani and the Urvi Marma are present both on both sides, in both arms and both legs. So the Ani Marma is present 3 fingers above the crease of the elbow. So here we have the crease of the elbow and in the front. So you have to keep the arm like this with the palm facing forward. And the Ani Marma is present in the back of the knee. So this is the crease of the elbow and here is the crease of the knee. So 3 fingers above the crease of the knee at the back and 3 fingers above the crease of the elbow in the arm is the Ani Marma. And 4 fingers above the Ani Marma is the Urvi Marma. So both these Marma points are in the midline. So it's important to keep the arm straight like that and not pronated so that this Marma is localized in the correct position. Similarly, the Urvi Marma is present 4 fingers above the Ani Marma in the back of the thigh, in the midline. So the Marma points in the upper arm, both the Ani and the Urvi Marma, benefit the lungs, the heart, and the esophagus. Whereas those on the lower limbs benefit painful conditions in the lower limbs like filariasis, varicose veins, deep vein thrombosis. The ones in the arm will benefit golfer elbow and tennis elbow. And the Marma points in the arms also improve lymph flow in the arms. So very good to stimulate after mastectomy, breast cancer surgery, and so on. And also they control the channels of water metabolism, thereby improving kidney function. So let us see how this is stimulated. So keeping the arm straight with the palm outstretched, measure 3 fingers above the crease of the elbow and press with the thumb, applying pressure, releasing. So we press about 15 to 18 times a minute. That is the frequency with which one presses. So 3 fingers above the crease, pressing with the thumb, supporting with the fingers behind, press and release, press and release. So this is the way the Marma point is stimulated, about 15 to 18 stimulations per minute. The Indrabasti Marma is present 4 fingers below the elbow or the knee. So this is the crease of the elbow. So 4 fingers below the elbow, in the midline, in the forearm, is the Indrabasti Marma. Similarly, behind the knee, 4 fingers behind, below the crease of the knee, is the Indrabasti Marma. So there are 4 Indrabasti Marmas, 2 in the upper limbs and 2 in the lower limbs, one on each side. So the Indrabasti Marma, this is another technique. They can be stimulated by compression with the thumb, as we saw earlier, or this Indrabasti Marma, especially in the calves, it has a lot of blood vessels. So we don't want to apply too much pressure, which will damage the blood vessels. So this is a good technique by which the Indrabasti Marma in the lower limbs, in the calves, can be stimulated. So one sits in the squatting pose in the Malasana, and with the hands, the forearms going behind the calves. And if you do this kind of movement, sitting up and down, you will press the Indrabasti Marma, which is in the upper part of the calf muscles. And this helps benefit the Apana Vayu, which is the Vayu in the pelvis, and thereby helps relieve constipation. It benefits the function of all the other pelvic organs like the kidney, ureter, bladder, and prostate. So it's very good for conditions where there is benign hypertrophy of the prostate, with frequency of urination, difficulty in urination. It also balances the Samana Vayu, which is responsible for digestion in the intestines. And Indra is the lord of rain in Indian mythology, and Basti is a word in Sanskrit for bladder. So this Marma regulates the water metabolism in the body. So whenever there's fluid retention in the body, it is good to stimulate this. And as we already discussed, it benefits the kidney, ureter, and bladder, and also the sweating. So if there's too much sweating or too little, that can be regulated or balanced by stimulation of the Indrabasti Marma. The next Marma in the legs is the Janu Marma. Janu in Sanskrit means knee. And this is the Marma present on the back of the knee in the popliteal fossa. And it benefits disorders of the knee like osteoarthritis, will also benefit leg fatigue, and liver and spleen, so which are the sites of Ranjak Pith. So all these disorders are benefited by stimulation of the Janu Marma. And you can see here how it is stimulated. So placing the hands on either side of the knee with the thumbs in the front on the shin and the fingers pressing at the back on either side of the popliteal fossa. This Marma is stimulated and it helps in all these conditions, especially conditions of osteoarthritis in the knee and the liver and spleen. The next is the Kurpara Marma, which is Kurpar in Sanskrit means the elbow. And so it is stimulated on either side of the elbow joint. So here on the outer aspect of the elbow, you see that there is a small depression, a pit, where the radius and the humerus meet. So humerus in the upper arm, radius in the lower arm, and there's a slight depression there. And also on the inner side where the humerus meets the ulna. So both on the outer aspect of the elbow and the inner aspect of the elbow. So it benefits all the organs between the umbilicus, that is the navel, and the heart, which includes the liver, spleen, pancreas, stomach, diaphragm, and gallbladder. So it will benefit conditions like diabetes, hepatitis, hiccups, and cholecystitis or inflammation of the gallbladder. And this is how it is stimulated with the thumb. So we're stimulating the outer aspect of the Kurpara Marma first. So we hold the hand, and where the middle finger touches, in that depression, it is stimulated, and the inner aspect can be stimulated by the thumb. So the joint is stimulated, the marma is stimulated both on the outer side of the joint as well as the inner side of the joint. Manibandha Marma is the marma which is present in the wrist. So it is at the wrist joint, and it's said to be about 2 finger widths wide. It regulates mental disorders and stress levels, and also benefits carpal tunnel syndrome and all kinds of arthritis in the hand. You would have seen that when someone is stressed, they tend to hold their wrists, and they'll keep their hands behind their back and hold the wrist or one hand with the other, with the fingers of the other hand, and walk up and down. So that's a normal posture we go into, or the normal, this is, so it regulates mental stress. So this is how it can be stimulated. So you hold the wrist at the wrist joint with the other hand and move the wrist in a clockwise direction and then anti-clockwise direction. So this way the Manibandha Marma can be stimulated. And this is part of the Sukshma Vyayam which is done. The Talahridaya Marma. Hridaya means the heart, and this is the heart which is present in both the palms and the soles. So Ayurveda talks about 5 hearts. So one is the anatomical heart in the chest, which pumps blood. Then we have 4 more hearts, that is 1 each in all the 4 extremities. So 1 in each palm and 1 in each foot. So that's 4 plus 1 anatomical heart in the rib cage, in the chest. So this is present in the center of the palm, right here in the center of the palm. And it regulates the Vyana Vayu, which is responsible for circulation. So therefore, it is very closely related to the heart, because this regulates Vyana Vayu, which is a function of the heart. And so it benefits heart diseases. It regulates blood pressure, both low blood pressure and high blood pressure, and conditions like hysteria and epilepsy. And also, it is good to stimulate this point in developmental disorders in children. So it is located in the center of the palm, and the way to locate this Marma point is by bending the middle finger. So you bend the middle finger and the point where it touches the palm. So that is the point where the Talahridaya Marma is situated. So you can stimulate it by pressing it with the thumb of the other hand. So you press and release, press and release. So stimulate about 18 to 20 times. And interestingly, this, as we know, is related to the heart and to circulation. And when Jesus was crucified, this is the point where the nail was stuck. So in both palms and both feet. And so injury to these points can be lethal. As we discussed earlier, injury to the Marma points can be lethal. The Kshipra Marma is again present, one on each side, both in the upper limbs and the lower limbs, in the hands and the feet. And as you see here, it is present in the wedge between the thumb and the first finger. So in the palm here, and also in the foot in the similar location. So it benefits the thyroid, tonsils, esophagus, heart, lungs. Also good to stimulate when there are convulsions and hoarseness of the voice. So these are the benefits of stimulating it in the upper limb, and it can also be stimulated in the lower limb. And Kshipra in Sanskrit means fast. So this is a very fast marma. That is, stimulation on this marma yields very fast results. So it can be used for pain relief. This is how the Kshipra Marma is stimulated in the foot. So this is the way to identify. If you bend the big toe, there is this knuckle which is raised, and so you take the other thumb, the thumb of the hand, and press in the space between the metatarsal of the big toe and the second toe. And the advantages of stimulating this marma in the lower limb, that is in the foot, is it helps relieve backache, leg pain, sciatica, and in fact pain anywhere in the body. And it is also used to reduce excessive libido. So this is a practice done by yogis. They wore sandals like these, which are called the khadaun or padukas, which have a knob which is held between the big toe and the second toe. And so it produces a pressure effect on the Kshipra Marma, and it helps to reduce the sexual desire. The Gulpha Marma, which is present at the ankle joint, it benefits the sacrolumbar region and disorders of the rectum, bladder, and uterus. So basically the entire pelvic region. And so it benefits infertility. So if it can help treat infertility by actually toning up the uterus and the ovaries, helps in conditions with sciatica pain and lumbar spondylitis. So this is the way to stimulate it. So you basically roll the thumb here at the ankle, and you'll be able to feel the tendon as you roll your thumb up and bring it close to the bone. So you roll it here against the bone, that is the tibia, and this helps to benefit all these conditions. And this is a very, very important marma. The Krikatika Marma is present at the back. It's present at the junction of the skull and the neck. So it benefits conditions of Parkinson's disease, where there's a constant nodding of the head, and also disorders of neck movement, so cervical spondylitis. Also benefits headache. And this is the way to stimulate it. So it could be stimulated by placing the thumbs directly on the back, on the point, but it can also be stimulated in this way by placing both hands behind the head and then pressing forward, making sure to keep the head straight and not bending the neck forward, keeping the head straight and pressing with both hands. The next marma on the back is the Parshvasandhi Marma, which is present at the level of T12, that is the 12th thoracic vertebra. So this is the cervical vertebra, this is the thoracic, that is the vertebra present in the region of the chest. And this is where the rib cage ends, that is the 12th rib, the 12th vertebra, and then this region here is the lumbar spine. So right here at T12, the 12th thoracic vertebra, about 4 fingers from the midline, here is the point which is called the renal angle. So this is the costal margin, that is the margin of the ribs. So 4 fingers from the midline in the region of the rib, here, the margin of the rib. This is the Parshvasandhi Marma, and it benefits backache, low backache, and also since this is the place which corresponds to the renal angle, so stimulation of this marma benefits disorders of the adrenals and the kidneys. So when we we are tired or when we have a backache or when there's fatigue, that usually represents adrenal fatigue. So we tend to hold our waist like this. We tend to place our hands on the waist like this. So we are stimulating that point. So most often we adopt these postures as a corrective mechanism to correct the imbalance in the body, even though we are not aware of these marma points. This is how nature has built in this protective or regulatory mechanism. The Vitapa Marma is present on the midpoint of the inguinal canal. So if you take the pubic tubercle, and here is the anterior superior iliac spine, so this is the inguinal canal. And so at the midpoint of this is the Vitapa Marma, and it benefits conditions such as infertility, inguinal hernia, sexual disorders like erectile dysfunction, premature ejaculation, and nocturnal emissions. So if you sit in Padmasana, the point where the heels touch the inguinal canal is the point of the Vitapa Marma. The Amsa Marma, it is present in the trunk and here, so where the neck meets the shoulder, right here on both sides, and it benefits neck strain. So cervical spondylitis, pain in the neck are benefited by stimulation of this marma, and also headache. So let's see how this is stimulated. So you keep the arm at 90 degrees here at the shoulder, and then bend the forearm at 45 degrees. So the point where the middle finger touches is the Amsa Marma. So we keep the arm at 90 degrees, forearm at 45 degrees, and the point where the middle finger touches the junction of the neck and the shoulder is the shoulder girdle, is the Amsa Marma. Then the Amsaphalaka Marma is present about 8 fingers below, so the Amsa Marma, and it benefits shoulder stiffness, upper back pain, lungs, and liver. So this is the way to stimulate it. You take the hand back and apply pressure with the middle finger. So the point where the middle finger touches is the Amsaphalaka Marma. Then the Basti Marma. Basti, it means the bladder. And so this benefits benign prostate enlargement, which usually presents as difficulty in urination or frequent urination. It also benefits recurrent urine infections, bladder inflammation, and bladder atony. And this is the way it is stimulated. So you identify the navel and keep the fist below the navel and put the other hand on top and bend forward. And this way, as we bend on the out breath, we're putting slight pressure on the bladder area, thereby stimulating the Basti Marma, which is very good for all diseases of the bladder and prostate. Kakshadhara Marma is the marma which is situated in the deltopectoral region. So here is the deltoid muscle and the pectoral muscle. So here in this groove, 2 fingers below the outer 1/3 of the clavicle. So this is the collarbone, the clavicle, and the outer 1/3. So here, 2 fingers below this, somewhere here is in the deltopectoral groove, is the Kakshadhara Marma. An excellent marma for frozen shoulder. So if there's pain, frozen shoulder, it works very well, and also good to relieve muscle wasting in this shoulder region. It improves the lymphatic drainage in the arm. So this is how you identify. This is the length of the clavicle, the collarbone. So locate the outer 1/3 and 2 fingers below there. So you press upwards and backwards. It's important not to press downwards because the brachial plexus or the nerves for the arm run below this. So the pressure should always be backwards and upwards. Identifying the lateral or the outer 1/3 of the clavicle, 2 fingers below, applying pressure with the thumb upwards and backwards. The Nabhi Marma. Nabhi is the navel and it is an important center in the body. So it is related to the Samana Vayu, which is the Vayu which is responsible for digestion and peristalsis, and Pachak Pit, which is the digestive pitta in the intestines. So it benefits all the digestive disorders, especially irritable bowel disease and so on. So sitting in Vajrasan, we place the fist of one hand and place the palm of the other hand on the fist and bend forward as you breathe out. So as you breathe out, you bend forward, applying slight pressure on the navel, thereby stimulating the Nabhi Marma. And breathe in as you come up, and breathing out, you bend down. So this is stimulation of the Nabhi Marma or the Manipur chakra, which is responsible for digestion. And this is the point where we are connected to the mother in the uterus, that is at the navel through the umbilical cord. And so this point not only helps to stimulate the digestion, but also this is the seat of life. In fact, in the Ramayana, Ravan is killed in the end by Ram when he strikes the arrow at the navel, because there's a pot of nectar at the level, at the site of the navel. And Ravan is depicted as having 10 heads. So even though each head is chopped off, Ravan doesn't die. But finally, the secret of his life is in the navel. So the navel is supposed to be this site or the seat of life. And yoga talks about the 4 levels of speech. So the Paravani or the Para speech actually resides at the level of the Nabhi or the navel. And this is where speech actually starts. And then it is at the Vaikhari level that it is articulated, but the origin of speech is at the navel. And all breathing techniques focus on taking the breath to the navel. So the Nabhi Marma is an important point, which is not only responsible for digesting food, but also important for digesting and processing of our thoughts. And so often when there is problem in the Nabhi Marma or in digestion, there is also a problem in processing our thoughts. And that usually leads to manifestations of irritable bowel and other problems. So it's important to stimulate all these marmas on an empty stomach. So before having a meal, or at least after 2 to 3 hours after a meal. These marma points should never be stimulated immediately after a meal. And you would have seen in some people, there is burping when they press a particular part of the body. That is, when they press their arm or any surface of the body, they burp. And this is a disturbance of the Vyana Vayu. So there is a lot of Vayu or wind which is trapped in the body. And so stimulating or pressing these marma points will actually help to release that trapped Vayu and will help in conditions of pain and also help to clear the emotional blockages that are present. So these marmas can be stimulated as part of the daily practice, and oils can be applied to the marmas, and these marmas can be gently massaged. It's important to regulate the pressure on the marma. So one should not apply too much pressure, which can cause damage to the Marma point, because these points are very sensitive points, and some points have many blood vessels. So it's important to regulate the amount of pressure. So if there is tenderness, you begin with a slight pressure and you can slowly increase the pressure. And you will see that as the tenderness, as you go on stimulating the marmas, the tenderness will decrease, and along with the decrease in the tenderness, there will be an improvement of the organ or the system related to that marma. So I hope that you benefit from stimulation of these marmas, and you can use them both in a preventive way and also in a therapeutic way to create balance. So namaste and thank you for your listening.